James Clam, how's my buddy doing today on Friday? I even know what day today is.
Hey, hey, Todd Ehrlich, it's you in Texas,
Yes, sir.
and I want to be in Texas.
Nah, California's good. I bet the weather's great out there.
It's actually quite nice where I live. I grew up in Hawaii.
Did
It
you
was a
really?
tough life.
I don't think I knew
Yeah,
that.
someone had to go through that tough life. But I have to say, where I live in Santa Rosa, California, it's about 30 miles in from the coast. It's one of the best living ecosystems in the world. The weather is just perfect, vanilla smell in the air, and you got to stay happy. And I had a great walk with my dog Jordan this morning, and
Oh, good.
I kind of turned my thought process off, and I made a point to listen to the sounds. And I tell you, the birds were happy this morning.
Is that right? That's good. You know,
In fact, you know what? I'm gonna do a recording of my morning walk sounds, and I'll play it for everybody. Maybe we'll do that at a future webcast.
one thing we have in common is peacocks. You have those white peacocks that hang around your house. Do you still have them?
We do, and I was just thinking about that. When they go to bed at night, they find their roosting areas up in the trees, and then they kind of talk to each other. And when I used to travel, I used to get up about 2 in the morning, and they would bid me farewell and wake up the neighborhood.
Yeah, we have the traditional blue Indian peacocks. We have a male and a female, and they're the best guard dogs ever. They do their business all over our back patio. That's the only bad thing. But if a burglar's coming around the back door at our house, he's going to have a
Uh,
big bird right in his face. So
Not a chance. Yeah, well, you've got some beautiful ones. I've seen your post on Facebook.
yeah, they're pretty cool. Pretty cool animals. Yeah, love your dog. And did you know that I recently got a dog as well?
I did do a sneak preview on Facebook, but
Yeah,
I know you have some nice dogs.
yeah, this is Barkley, our little brand new puppy. My wife Christine surprised me
Oh, I
again
love it.
with dogs. That's what she does, and that's Rusty, our little golden retriever dachshund mix. But that's Mr. Barkley right there. Kind of a cool little puppy, very very cool. Love him to death. And he's about this big. Like he's smaller than this
Yeah.
microphone. He's just tiny. Fits right in my shoe. So we'll have to keep him away from Jordan for a while.
Well, it looks like he's well accepted, though. He's well accepted by the group.
The dominance hasn't actually taken place yet, but it soon will. Hey, so we got man. Today is great. I'm so excited.
Oh man,
I'm so excited about our.
this guy changed my life. I have to. He was a pivotal point in my career, and I can't wait to talk to him.
Absolutely. I'm making a quick post here to get people to respond to us. So we had some great questions yesterday, and so I want to make sure anybody that's watching, let us know and tell us what you want to ask us or our upcoming guests. But hey, James, do you want to do your deep thoughts, or do you want to do them afterwards?
Um,
I forgot to ask.
hey, you know what? My thoughts are actually what I'm going to do this. This has a lot to do with Mark.
Oh, okay.
He didn't know I was going to say this, but Mark, it's time for some intimate conversations.
So we're going to
But
have thoughts with James right now, a new little segment, because we know how great of a philosopher you are. So thoughts with James. Here we go. Go for it, buddy.
well, I get that from my dad, and the thought for this morning is about gratitude. He taught me to always wake up with an attitude of gratitude, and he was a pastor, had a lot of responsibilities, and on his walk in the morning, he would share with me that he always thinks of 5 things he can be grateful for. And I like this quote from Zig Ziglar. He's the author of See at the Top. In fact, if you want a good audio to listen to on your walks, is go to and download the See You at the Top by Zig Ziglar. I've listened to that a number of times through the years, but he says this: the more you recognize and express gratitude for things you have, the more things you will have to express gratitude for. And that's a good segue for this morning, because I have a lot of gratitude for our guest, because I remember listening to him almost halfway through my career, and I'm 37 years into this now, and I made a choice at that event in Sacramento that changed my career, and I'm really I have a lot of gratitude for. I'm going to let you mention his name since you were going to introduce him, but I have a lot of gratitude for our guest today.
Yeah, we got Mark Morin. Mark, you're up now, buddy. And man, that is no doubt. I will never forget sitting in the first row, because I'm a front row sitter, in Chicago at the ACDNA meeting, and there you were up in your black suit and tie and everything. I goes, no dentist wears a tie, but this guy, man, I'm going to listen to this guy. And I was astounded by your enthusiasm in chairside dentistry. And you know the one thing that you got me on? I'm going to show it to you right now. I bought your book.
Oh my goodness sakes!
And you know, I was. This is an excellent book, by the way. When did you write this? About 99, 98?
Yeah, 99. Matter of fact, I just talked to Doug Boyers the other day about doing a volume 2.
Oh.
Since we're both on lockdown, I said, why don't we just write another book?
You should. This is an excellent book, and I was thumbing through it, and you've got, a lot of people in the CAD/CAM world right now think they got it figured out and they discovered something. No, you guys did it way back when, so you're definitely the pioneer out of this.
Well, I appreciate that.
You are the godfather of chairside CAD/CAM dentistry.
Mark, this is the godfather of CAD/CAM.
I appreciate that.
You made a difference in my life. And I was mentioning yesterday, Mark, occasionally we'll still see each other. Yep. And I'll never forget. I think it was it the 30th or the one after that? I'm sitting there on the convention floor, and I hear this little pressure on my shoulder, and I turn around. There you are. And every time I see you, I just smile.
James, you always smile.
No. This is a Mark Morin smile. I mean, every time I see you, I just get this happy feeling inside.
Well, that's great. I just am glad to make a difference in the world in my short time on the planet, and I hope I helped everybody move along and move this great technology to the next level. And it's been great for me, and it's been a great reward, and I still think it does a tremendous impact, not only for dentists but for patients as well. So I think it's a tremendous opportunity that we had, and let me tell you, I look back on those days as magical. I mean, really just magical days. We were riding the wave there, and it was so much fun. So
what are you doing? What are you doing now? What's going on? Yeah.
But I'm glad to be home. I'm glad to be home.
So what's up in your world now? What are you staying busy with?
Well, I sold my practice about 2.5 years ago to a large DSO, which has been tremendous. They've let me run the place and sort of take control, but yet they manage it, which has taken tremendous pressure off me tremendously, especially in this time.
Yeah.
But I've taken care of my staff and my patients, and I still think we have an obligation to go forward. And it's worked out. Excuse me. It's worked out really well. And in this time of uncertainty, I think the one thing we need is leadership. Need strong leadership. You need confidence. And I think the patients are really going to come back to those people that really show confidence and they trust. So I think this is the time where, being trustworthy and being confident, I think is going to bring huge dividends. My wife and I made a video yesterday for our patients talking about, how we're going to do things differently. I mean, dentistry is always ahead of the curve because we already wore the mask and the gloves. But, I think we got to step it up to the next level. I think we're going to look like, booties and hats and, surgical gowns. And, I talked about, I bought a new electrostatic gun that sort of demists the air and the entire surface and kills hepatitis and kills everything. So I talked about using that in our operatories in terms of, taking it to the next level to sterilize these areas. And I think patients are going to look for that. So I think it's just about instilling confidence and getting back.
Hey, Mark, after our event today, will you go in the thread under this video and post the electrostatic gun and where we can look into that?
Yeah, it was Well, for $600, I didn't think that was a bad investment at all for $600.
Yeah, if we could get a link for that, I think our viewing audience would even love you more than they love you now.
Well, I'd be happy to help, and I will post it. I'll post it for sure.
Okay, great. Thanks.
Now, how do you see us coming through all this, and what are you kind of doing with your team, your family, whatever, your circle of friends, and how are you making us get through all this better?
Yeah, my team is very scared. I think they're very, very scared when this thing began. I would have stayed in and continued to work because I think I'm just a work bee, and it's what we do. But I think my team was nervous. So I think it's about giving them, confidence that we have the right PPE, that we're going to step it up a notch or two, and that we're going to screen patients coming in. I think that's another big one is that, we're going to take temperatures. We're going to go the whole 52 yards now, to make sure, we have the right distancing in the waiting room, and I think it's going to change dentistry forever. Reminds me a couple years ago, when I started, you guys are too young, but when I started, we never wore rubber gloves. I mean, I was a wet finger dentist.
Hey, Mark, don't let my makeup fool you this morning, but I didn't start wearing gloves until my 3rd years in practice.
See that?
I didn't start wearing. Yeah, I remember in dental school, the only time we would place gloves on was in the surgical suite back in the oral surgery.
Yep.
Or perio.
Man, how old are these people? Who signed me up with these old guys? What's going on here?
Yeah,
I know.
First 3 years, we never wore rubber gloves. It was a wet finger dentist. We were in there. And then it was the AIDS thing, I think, came along, and that really forced us to, buckle down, wear rubber gloves, and really change the way we do dentistry. I think we're at another one of those bumps in the road.
Well, let me ask you old guys something then, because obviously that... Obviously, that was a transition, right? I mean, you had to have the mentality like, oh no, I can't do this because how am I going to feel the Toffelmeyer? How am I going to feel the Wiedelstadt carver as I'm carving that amalgam down in there? You probably had some reservations, didn't you?
I used to put those TMS pins in, and with a rubber glove, I could never get that pin in. It was the pain in the butt to get that pin. So it changed the way things were.
There was major, for me, Mark, it was just this tactile thing, know? And now I need to put gloves on in order to feel things because this is, this perception that we get.
And now if my fingers get wet, I get grossed out. It's completely different. It's amazing how it changes it all.
Well, we do adapt. We do adapt. So what else are you doing with your office that you're going to adapt? I think we've already gotten some good tips from you today, but you talked about communicating with your patients, your team members, and what are you doing with your educational career right now?
Well, we're spending a lot of time online. I mean, we're sitting here looking at the 4 walls in my house. I think I fixed everything in my house and painted everything. And so, we're doing a lot of continuing education, just picking up on little nits and bits and little different things that we can pick up on. There's a lot of online education.
There is right now.
And to pick up a little education here and there, I never heard anybody. My wife is trying to talk me into getting the AGD fellowship exam. She wants me to go to Vegas in July and take that, although I haven't taken an exam in 35 years. I'm not sure I even know how to turn the pages and can pull this off, but I might consider doing such a thing. She's really pushing me to do it. So just fun things, really just looking at different education opportunities. We're into the marijuana business here now in Michigan. I have
Can you explain that? We have an international group here, so let's make sure everybody knows you're not a drug dealer. So what does that actually mean?
No, not a drug dealer. I'm a legal drug dealer now.
There you go. Okay, so tell everybody what that means.
In Michigan, marijuana is legal for medical purposes, being cancer, pain, discomfort whatsoever. So in Michigan, you could come to the dispensary here and purchase marijuana in order to treat those medicaments. And so we got into that business about 3 years ago, and it's been phenomenal. My mother has ovarian cancer and is taking CHB with THC, and it said, according to her, it changed her life. So I think there's great opportunity here in a material that's never been really studied fully for this pain relief, and I think it's a lot better than opioids and all these other things that are out there. So I think it's a lot healthier for you. And my wife talked me into getting into this business, and it's been booming. I mean, booming since we got into this business. And on April 28th, we go recreational, which means in Michigan now you can walk in the store without a medical card and buy it like you could alcohol.
I don't see that happening in Texas anytime soon. I don't think that's going to happen. Yeah. Hey, Mark, do you know how James sedates his patients? James, why don't you tell him how you do your sedation in your office?
Well, I know in my area, wine isn't the only big crop factor here. It's also the marijuana, and in fact, every time I go out of my office, I always smell skunks, if you know what I mean. So it's actually, they come out of their health club, and that's probably how they get zipped for the day. But it does have some good medicinal purposes, and I'm glad you're helping people. And I'm sorry about your mom, Mark. We love our parents, and we don't want to see them suffer. So
that's for sure. What's funny is none of us are getting out of here alive. It's hard to believe. We're not getting out of here alive. So, we're all not going to make it out to the other end in one piece. But, hey, yeah. It's like everything else in life. It's a transition. We move to the next place, right?
Well, how do you think the transition is going to be for us coming out of our slumbers and getting back into dentistry? I mean, what are the kind of things you're doing to prepare?
Boy, James, Todd, that's a really good question. I had this discussion with my wife last night. Like, do we think we're going to be as busy as we used to be? Do we think it's going to trickle in? Do we think everybody's going to come running back? And I'm going to be honest with you. I think we're going to trickle. I really don't think. We've been doing a ton of emergencies. Oh my! I've never seen so emergencies in my life. But I think that people are scared. I really think this one really shook people. And more so the millennials, for some reason they are like really freaked out with this. Yep. And so I think that it's going to be a while. I don't think we're going to, necessarily pick up and run like we used to. So, I was talking to Shauna last night. Our approach is going to be to really pick up these emergencies and open up and take care of these people that haven't been taken care of for a long period of time. Normally, we wouldn't see these emergencies as much as we would, but now I think we're going to open that up. I think we're also going to use a lot of marketing to our patients and videos showing them how we're really stepped it up to the next level in terms of sterilization and in terms of taking cleaning operatories and aerosol mist and that sort of thing. And we're going to pray for the best. I mean, there isn't much else to do, and hope that the patients come back. In Michigan, we're really hit hard here because of the automotive industry.
Oh yeah,
when the automotive industry shuts down, I mean, you might as well go home. There's nothing to do.
Yeah.
So until the automotive industry gets back, I really don't think people are going to move. Side at all.
My inclination is the same as yours. I think it's going to be kind of a drip for a while, because the people that are wanting to come back in, there's going to be those people, but then there's also going to be an equal number of people that are so afraid that they don't want to just jump back into society. So I think you're right in that regard, but who knows? I think it depends on demographics too.
What scared me the most was my hygienist. I mean, we were practicing on March 13th, and our idea was to go forward. I mean, I told Sean, I said, we used universal precautions. We'll take people's temperatures. We'll continue to work. When my hygienist came to me and said, we don't want to work. We're scared. We want to go home. I was like, wow. So I said, okay, well, if you guys don't want to work, we'll close her down. We'll go home.
Yeah.
So really that's what started the whole thing before they made the executive order here in Michigan was, we decided that the staff doesn't want to work. We don't want to work. We'll go home. So we shut the doors and went home. So to get them back, I think is going to be a different step. I mean, understanding that, I really don't think hygienists put out a lot of aerosols unless they're using the ultrasonic. I mean, that's what I think, it's probably going to get more dangerous. I think hand scaling teeth, I think is, a little less invasive than using the handpiece. So, I think they stand a safer, when you talk about level of exposure, a safer level of exposure than we do, unless they pick up that ultrasonic. Then I think that's a different ballgame.
What I would encourage everybody, particularly in the hygiene department, is get that ice light in there. of the dry shield, because
That's a good idea.
if you look at how it contains aerosol from treatment, it's tremendous.
That's
and so I really think everybody pop on board with Light or Dry Shield, because I think that's one way, and communicate that to your clients, because Todd and I were talking about this a while back. You know, we have to have a conversation with our patients. Mark, you're already doing that online. Are you doing that through your Facebook site, or how are you delivering that to your patients?
Practice software. You know, being a member of the DSO, these guys have got so much money invested in. So
you can communicate that way.
Yeah. So we're doing it through the software. We put together a little video. They send it out to the entire patient base with one click of the button. It just makes it so simple and so much faster. So we're doing it that way. But we're also having patients rinse with, Peroxyl and do all these different things that we never did before. But, I think it definitely is safer to do those kind of things. And I think it protects us as well as them as on both sides. And I think patients have a level of trust and
that's it.
Confident.
Yeah. It's the conversation. And Todd, you brought that up quite a few Facebook casts back, and is about having a conversation with your clients, because your clients, they trust us. I know you, Mark, and I mean, we've had patients for over 30 years, right?
Yeah,
and
sure.
Mark, I think you graduated in 84, right?
85.
Okay, I graduated in 84. And so we've been doing this a while. And, you know what I love? I really love my clients who I've seen that whole time. In fact, some of them in their 90s now, and I love them to death. And I was talking to one yesterday, and he had a toothache, and we managed it with some antibiotics. And I told him, well, let's keep you housed up until we know it's safe for you to come out. And he was just thanking me about that. And I did a follow-up phone call with him, and he goes, This stuff is magical. I have no pain now. You're the best. And but that's what it's all about, is taking care of our clients, and we have to be creative at the time that we're in. And I know, Mark, you were that major creative factor that sparked a new thought process for me in my career. And when the chips are down, that's when it measures who we are as people. And we're just going to have to be creative and find new ways of delivering trust and services that will take care of our clients. So, things like this have happened in the history of this world. There's always been civilization and communities that had to go through devastation, and that's part of living. And what we're going to do is, I see that you got more than one resource revenue intake, and I think that's really important. I know Ziegler said that a while back. Todd and I, and you as well. I'm an educator, which we aren't doing much of now, but I'm doing tons of education online, and we're also dentists, and now you're a pharmaceutical rep.
Well, James, first of all, I think this is the best thing for dentistry. I hate to tell you, we needed a reset button. I think patients were getting to the point that they thought all dentists were interchangeable and they could just go anywhere. And I think this brings us back to why we're important again, and why your dentist that you've been going to for years is so critical. So I think this is a great reset button, a huge opportunity. But I also realize that as a dentist, I only made money if it went through my fingers.
That's right.
Me, I want to retire. I want to sit home. So I knew I had to have a new passive income, a way of income. I look at these insurance guys that get checks after you buy the insurance policy for the next 30 years, they get a check. That doesn't happen in dentistry. So for me, it was all about finding another source of revenue that was passive, where, I didn't have to be working. I love my lifestyle. I do not want to change my lifestyle ever. So
I live vicariously through Facebook through you. I need to get on your boat one day.
Mark, we wanted to talk about your boat before we sign off here, because I want you to be the captain of my ship.
There you go.
So I love my lifestyle. I don't want to cut down.
Yeah.
So having a passive income that I'm not directly involved with has been, it's been a godsend. It's been absolutely phenomenal, and it's worked out really well. Again, James, like you said, gratitude. I thank my lucky stars. If I had to do my life all over again, I wouldn't change one thing. I'd do exactly the same thing I did the first time, just with probably bigger and bigger and bigger and bigger and bigger as I could go. But it's turned out well, and I've appreciated it, and I'm always grateful for you guys carrying on and for what you guys do, and I'm just grateful where I am and how I got here.
So, Mark, if you could talk to this Mark, where am I? Right.
Yeah.
If you could talk to that Mark, we get lined up. There we go.
Yeah.
Next to Doug. And this Mark was going through what's going on right now. What would you tell him? He had a brand new practice early in his career, probably way mountain of debt. What is he looking at coming out of this? What's the next few months? What's the next year? What do you think is going to happen to young Mark?
Wow. Todd, I get that question a lot, believe it or not, from a lot of young dentists. And my opinion is this: dentistry is a far different animal than it was 35, 36 years ago. So for me, I think the key is going to be efficiency. It's going to be learn how to be very efficient. It's going to learn how to really use technology to your advantage. I don't think you're going to see 30 patients in a day. I don't think you're going to see, like we used to in the old days. I think you're going to see 4 or 5. So the key is going to be providing really comprehensive dentistry on those 4 or 5 people, creating a really good relationship with those 4 or 5 people, and really being able to deliver services that are efficient. And I still believe CAD/CAM does that for us. Being able to do a crown, an EMAX crown, in an efficient amount of time, without a big laboratory bill and impressions and that sort of thing, in my opinion, still is the key. I would still tell a new dentist that without this technology, you are absolutely crazy to think that you're going to be able to provide services in an efficient, effective manner.
So one of the discussions, sorry, James, one of the discussions we've had with these interviews is, do you think this would be, this seems backwards to me, but maybe I'm coming around to this. Do you think it's a possibility to actually start investing in technology right now when there's things so scary? Is it a time to step across that line and start doing things differently, basically?
In my opinion, I think it is. I think now's the time to make a deal, because let me tell you something. Everybody's going to be hungry to sell equipment. Everybody's going to be hungry to sell cars. Now is the time to make the deal. In my opinion, I'm a wheeler dealer. I'm gonna negotiate one heck of a deal right now, because I think you're going to be anxious to sell stuff. Everybody's anxious to sell stuff.
It's going to be a two-way street. And yesterday Todd shared about a Ford dealership that can't keep a car on the lot because what they're doing is taking the risk. Well, that's the Ford dealership. But, they're giving 0 interest and no payments for 18 months or something like that.
Yeah, that's crazy.
And I think our profession needs to look at that because, because who's taking the risk? I mean, it's the company. And the thing is that when we take the risks, that's when you find your moment of clarity. And, sometimes when your back is against the wall, that's when you dig a little deeper. And I'm a total fan of getting to technology so you can be better at what you're at. And I'm sure the companies, and they're listening to this right now, Todd, they're going to provide avenues to get this into your hand without a significant financial risk so you can get up and going within the next year.
Hey, greater risk, greater reward. The bigger the risk, the bigger reward. I mean, in 1990, I stepped off the cliff and went for it. And I mean, it's paid me great rewards. And I think that's what you got to do. If you want to get there, man, you got to go for it. I'm always a believer to go for it, and I'm still a go for it.
Mark, without saying product names or anything like that, what kind of deal do you? Because CAD/CAM's expensive. Let's just call it expensive across the board. What kind of deal and payments and do you think we should be getting in these times?
You know what? If I was either one of those companies that sell that technology, in my opinion, I think it should be 0% interest. I think they should give you a year to use it. Generate some income with it, pay off some bills, and then slowly, gradually come back into payments. And when they started with technology, remember CAD/CAM, they started with an escalation payment. You started with a low payment, then it got a little higher, and it got a little. I think that's the way it should work now. I think it should start out bare minimum, if nothing, and then go up every year a little bit, so that you could, you can make money with this thing and control the income. I think this economy is going to be hurting for a while, unlike what a lot of people think. We're going to snap back into it. I don't think that's going to happen. Look at the price of oil. I mean, look at the price of cars. Like you said, now's the time to buy. I'm telling you right now, now's the time to buy. I had a generator company out here yesterday looking at my house. I want to put a full generator in. It started out at $2,000, and by the time they left here, I had them down to $1,200, and we were still going down. You know, and I'm
Mark,
like, you know,
Mark, you're just the best. You're just the best, right, Mark. You're the best, man. Yeah, thank you. You inspire me. See, I'm smiling again right now. I'm smiling again. This is the Mark Morin smile, and we want our audience to smile.
James, I have one story. If you remember, you and I and Todd, we were in that great big Patterson meeting at corporate, and they were asking us for all our ideas. Tell us what you're going to do. And you were telling them, and I kicked you under the table, and I go, James, don't say anymore. Just be quiet. You go, why? I go, they're going to take all your ideas and put it into place.
Mark, you know what? That kick was nothing but just a love tap.
It was a love tap. That's exactly what I was just protecting you. Don't give away.
I remember that now. Well, see, Mark, even though we're the same age, I've always said you're kind of like a dad figure, and I say that with respect because I love my dad. My dad was a major portion of my life, and he impacted me in many ways, and you've impacted me, and that's why I was so excited when you mentioned that. You were on our feed, and I was right online there. I go, Todd, we got to get Mark Morin, and I know we don't bump into each other a lot anymore, but the memories are strong, and I look at you as a positive connection in my life, so I really appreciate that.
James, that means a lot to me because I know how much your dad meant to you after talking to you tonight. I had no idea you grew up in Hawaii. I didn't know that either.
No.
So it's great to hear those stories.
Mark, I had long hair.
Oh, jeez. So did I. If I showed you a picture, you wouldn't believe me either. I had really long hair.
Well, I did see a picture of you that you posted this week on Facebook, right?
Yeah.
The glasses were great.
Those were great.
Poindexter look. Yeah, I look at that picture and go, boy, that was a different guy. But I tell you what, I appreciate you guys because I appreciate the gratitude. I appreciate the shout out. And, I have all the utmost respect for both of you because, even in all this turmoil, we always stayed close. And I appreciate your message, James, and yours, Todd, and what you've done for the profession and how you've continued to push this thing along and help all these dentists. And, my main goal, my main goal when I started this was to make money. I'm not going to kid you. I did the education thinking I was going to make money. Then I realized that it wasn't the money. Mm-hmm. It was the changing of lives. It was the pushing forward of the profession that became my message. And when that happened, for me, it settled my heart and really, really gave me some incredible gratitude. And for me, that was the key. And I'll never forget those days. It was phenomenal.
Well, that's how we kind of evolve, and I think part of getting 50, you kind of look at your purpose in life, and we're beyond 50 now. And I think about, contributing back to others so others can make better choices and have a better life. And when they have a better life, we have a better community and we have better families. That's a good place to be in.
Hey, Mark, let me put you on the spot right now. How about a reunion and we do CAD Cam in the sun?
Hey, yeah. I would love. You know what? I've had so many people ask me to do that.
Yeah.
Put that back, CAD Cam in the sun. I would love to. I always those events still to this day probably were the most important events, pulling those people together, hanging out. Like it's always kind of cool. When you do a lecture, you're in front of those people, and then they go home, and it's like it's over.
Yep.
But when you do those CAD Cam in the sun, you have a chance to sit by the pool. You see each other for 3 or 4 days, and you sort of bond and you become closer. So hey, whatever I could do to help, I'd be more than happy to help and put one together.
We're going to Aruba.
Yeah.
Well, Mark, I remember the first one that you invited me to was the one at the Trump Resort in Puerto Rico. Remember that one? That was an incredible facility. I still have pictures from that. It's right on the coast.
Yes.
That pool was amazing.
Remember we had
the pillars were there.
Everybody had a butler.
A butler?
Yeah.
Yeah.
Oh my gosh.
That was probably one of the. They closed that place since then, but that place was so unbelievable spectacular. And I stumbled across that place.
I was. That was great. I have good memories of that. And Mark, I have a picture of you and me there. And what was dawning to me just the other day, in fact, I was going to pull it out. It's just you and I were pretty thin back then.
we were. You know why? Because we never slept or ate. We were running on airplanes and flying everywhere.
Mark, have you tallied up how many miles you have flown in your career?
You know what? I haven't, but when Delta sent me a letter the other day and said that I'm a 2 million flyer miles, I was like, wow, that's a lot of miles.
Yeah, because I knew, I mean, you were the man that flew around the world spreading this message about
when you're doing it, it becomes a habit, right? I mean, like, Thursday I'd pack my bag, drive to the airport, park in the same spot, talk to the same people. And when I got out of that, and I stayed home on Fridays, I was like, what was I thinking? It's so nice to be home on Friday.
Yeah. It's interesting because I flew a lot for a while. And then 3 years ago, I ran into this health issue, and I just hardly am ever leaving now. And occasionally when I go to the airport, I'll go to a restaurant that I go to, and people, they're going, we haven't seen you in a long time. And it's almost like you develop this little friendship with the restaurants and the people that get to see you, and I kind of miss that.
And I go to valet parking, they're like, Dr. Morin, where have you been?
Oh, that's great, Mark. Well, we share a lot in common, and thank you so much for being here today. You have inspired me, and I know you have inspired our audience.
Well, great. Hey, thanks for bringing me on, and hey, anything I could do in the future, you know where to find me.
You know what? You know what we miss in CAD/CAM is your energy, man. You bring a level of energy that nobody in our business does. So, man, I truly appreciate it.
Never
seen it since, Mark.
I appreciate that. I do, and to me, it's just passion. It's just passion for life. It's the passion for the technology. It's the passion for our great profession.
Absolutely.
And to me, everybody needs to have a little bit of the juice as well.
Yeah. The juice.
Are you talking about your marijuana juice? Or are you talking about the? What are you talking about, buddy?
I'm talking about passion for life.
Hey, I think we have a new nickname for Mark.
What's
the
that?
Juice.
The juice.
The juice.
He's going to be the godfather of juice on his street corner.
I don't like the godfather better. I think that's better. Juice. I don't want to get too close to that O.J. Simpson juice stuff.
Mark, you got any last words for your audience out here today? Thanks so much, brother.
Words. Well, you know what? Again, the sense of gratitude. I'm going to tell you, take it by the horns. Don't be shy. Exude confidence and trust. And take good care of your patients and yourself, and keep your team safe. I think that's the key. I think we'll all get through this. I think it's a bump in the road. And I think it's the future. I don't think this is the first time we're going to see this. I don't think it's the last time we're going to see this. I think it's gonna be one of those things that we have to deal with for the rest of our lives. So you might as well prepare for it now and get used to it. And it's going to be a way of life, in my opinion.
All right, Mark. Thank you, man.
Okay, Mark.
We're going to have you on again. We're going to have you on.
Safe.
Hey, love you, brother.
Love you too, man. I love both of you guys. Stay safe.
Yeah. Thanks,
Bye,
man. Thanks so much.
Thanks so much, man. Appreciate it.
Thanks.
Yeah.
Wow, James, what an awesome guy. So everybody out there that's watching, you got to understand when James and I decided to do this, Mark Morin's name was like one of the first people we even thought of, and we knew it was going to be a big show. So thanks to great godfather of digital dentistry for sure.
Absolutely, and that was inspiring. And I'm looking forward to him posting on the Facebook about his ionizing gun, so we can optimize our rooms and make patients need to know that. Like I know here at home we have some filters, and where they clean the room and they take care of all the viruses and bugs, and I'm going to move those over to the office.
Well, when he said ionizing gun, I was thinking, man, I need to up my game and my arsenal in the bunker. So I wasn't quite sure what he was talking about right there. Like, because we have open carry here in Texas. So I didn't know what that meant actually. So,
well, that was a lot of fun, and the fun doesn't end with Mark. We have another guest later on today, don't we?
Yes, we have Christine Adland up yonder where you live, which is going to be super cool. She's a great clinician. We've seen just an amazing amount of work from her, and true leader in dentistry. So she's coming up just right after this. So James, you got any last words or advice for me or my friends out there?
Well, it's a lot of fun today, Todd. I do appreciate connecting like this. I almost feel like we're in the same room, connecting even when we're not online using Skype. It's a really nice way to go eyeball to eyeball, and there's nothing like being eyeball to eyeball in any conversation.
Yep.
And,
that's exactly right.
So I think my goal today is just connect more with people and enjoy the fellowship being with others.
Amen. Thank you, brother. Thanks, everybody, for watching, and we'll see you right around the corner.
In a little while. Bye.